Moniri balloons are specifically designed to be used with Moniri auto-inflation devices. The blue balloon provides low pressure and the red balloon high pressure. Start with the blue balloon. Place the balloon on the top of the T-tube using the four-finger technique. Insert 4 fingers into the balloon to stretch the opening, position the balloon on top of the T-tube and let go. Avoid pulling with fingertips or nails, since this might damage the balloons. The balloons may be stretched using a pump. To use the pump in the Moniri baby device, remove the mask and cover the opening. Then press and hold the security valve on the frog's neck and squeeze the frog's belly to pump in air. Inflate the balloon to a maximum diameter of 5 to 10 centimeters. With the mask correctly sealed, the treatment is efficient even with small movements in the balloon without total inflation. For symptom relief and treatment of glue ear, perform 10 inflations 2 times a day during 4 weeks. Continue the treatment even though the child is unable to inflate the balloon completely. If no clinical effect is observed, repeat the treatment with the red balloon for high auto-inflation pressure for another 4 weeks. In case of side effects, stop the treatment and contact your doctor. Moniri Medical. Innovations for a better future.